my name is Charlotte. I'm part of the outreach team for critical care. So predominantly our role, it's kind of the bridge between the unit and the wards. You know, we're there to pretty much support ward staff, especially during times like this when it's become incredibly difficult for everyone in the hospital. Our main priority at the moment is trying to keep patients at ward-based level at the minute to try and take the pressures off the intensive care unit. So we're using different techniques at the minute, such as non-invasive ventilation, which is the type fitting face masks. We're also using different types of nasal cannulas, which again is another treatment, and obviously we've got numerous recovery trials going on at the minute to try and prevent patients from coming to the unit. Most certainly in the first wave we've seen a difference this time, where you know, the priority's kind of been taken on at the wards to try and take the pressures off the intensive care unit. At the moment it's incredibly difficult for ward staff because you know, of the they're incredibly unwell on the wards at the moment. We are also trying to educate staff as well, so we're educating on the wards as one-to-one on techniques such as the non-invasive ventilations, you know, which seems to be working at the minute. We've obviously seen a difference this time because, like I say, we're focusing more on the wards to take the emphasis off critical care and try and keep as many beds as we can. Obviously if we do need to admit patients onto the unit, you know, we're trying to facilitate that quite quickly because these patients can deteriorate quite fast on the ward or within critical care.
It's been an experience that I never want to experience again. It's been really upsetting, very sad.
Very, very busy. Since March we had a really big influx of patients, really sick, critical patients. It's still very serious, and I still urge people to adhere by the rules. We have to adhere by the rules within our work, within our family environment, so I don't see the reason why other people are not following the rules. They're putting more pressure on us and within the hospital. Yes, I mean, since March we've had to come into work every day and wear the full PPE outfit, which isn't nice, isn't comfortable, especially when you work 12-hour shifts. But that's what's protected us through the situation. So yeah, we wouldn't say we're glad to wear them, but we're glad we have them because obviously it's protected us and protected our families.
So I would definitely say, especially with Christmas approaching, you know, even myself, my own personal self, I'd love to go around and see my mum and dad and, you know, all of my family, but at the end of the day we've got to think about others. And you know, we're here working sometimes 12 hours in full PPE, you know, the full suits and masks to try and save people's lives. It's so important that people, you know, listen to the rules, you know, wash your hands please, try and abide, you know, by sticking to your guidance with, you know, metres apart from your family. I know how incredibly hard it is, and yeah, just stay safe.